blood stasis. And you said, how often do you run into blood stasis? The patient shows no pain. Why do we need to use blood stasis? I come from sharing with you the experience of it. I had a couple, this particular concept here, let me give credit to the one who I learned this from. This concept, blood moving associated with cholesterol issue, I have to attribute it to one of the Dr. Yan Dexing is actually from Shanghai University. He's been dealing with anti-aging and also geriatric care. So his focus is really on blood moving. Doesn't matter what the condition is. He is considered blood moving branch of TCM. So he had his uniqueness. His argument was to treat cholesterol, lower the fat, lower the serum cholesterol protein alone may not directly benefit. It may take a little bit longer, but increase the blood moving effect, you might see a speedy result. And because of that concept, for the last couple of years, I run into two cases that doesn't matter what I give them. Doesn't matter what they were on in terms of, you name it, ranging from anywhere from Lipitor, Zocor, Tricor. Doctor have been prescribing many different medication, anti-cholesterol or lower cholesterol medication. She's not responding. She's probably in her late 50s, early 60s. She had a history of uterine fibroid and a couple of also ovarian cysts. She had a surgery with that. So the constitution, blood circulation is not at the optimum. So she came to me. I also found a traditional way of using serum lower cholesterol lowering herbs, such as ranging from red yeast, dampness removing, damn flame resolving, 山楂、鸡内金、决明子, digestive, purging, you name it, we tried it. I could not find a formula that will work. So her serum cholesterol often fluctuate with medication anywhere from about 250 to about 290 constantly. Some good result come back maybe right in the 240. Some not as preferable result may go up to the 280, 290. So we couldn't understand. I said, so I discussed it with her. We did everything we could from a both Western and TCM standpoint. I said, I still have not tried to see, maybe approach it from a slightly different perspective. So I discussed the condition with her. I said, if you want to try, let's look at this perspective. So I start explaining the concept of traditional Chinese medicine in terms of blood moving with her. And she said, I'd be more than happy and glad to try and see if it will turn it around. So initially, I'm taking the blood moving concept specifically in the liver per se. So I'm using a very classic formula called 葛夏竹鱼汤. Traditionally we use it for hypochondriac pain due to liver qi and blood stagnations. I said, let's start with this formula plus. Let's start with 葛夏足鱼汤 and 越菊丸. Let's have you take these two formulas for about 6 weeks, and then have you re-examine and see if your body responded. I did not give her decoctions, herbs. I gave her scientific capsule. What I prescribed to her is 5 TID and 3 TID of these two formulas. So she will be taking 8 capsules 3 times a day with meals, 24 capsules a day. So I had to take it for about 6 weeks and have it re-examined. After 6 weeks, her cholesterol registered 207. Overall cholesterol is 207. Her LDL lowered tremendously. Her HDL at 70. So we were extremely happy, thrilled about the result. And she said, my cholesterol for the last 2 years, even with medication, never dropped below 135. But instead of approaching it, dampen removing, restore, nourish, vent the liver, etc., didn't respond. So we decided to take the approach of blood moving. I use 葛夏足鱼汤 plus 越菊丸 instead. I put her on these two formulas with the same dose consistently for 6 weeks, and I came back with wonderful results.